They served and in many cases fought for our freedoms, but now many veterans say that care that they count on now at home is being cut. The VA's Home Health Aide program, you may know about that. It's a lifeline for more than 15,000 Texas veterans alone. It's cutting caregiver hours and pay. And for the past 6 months, the I-Team's Brian New has been covering this specific issue. And tonight, Brian is ready to share the impact that these latest changes are having on those who have served us.
For much of his life, Harold Roper reached for the sky and beyond. Roper served in the Air Force, then worked for NASA, including on Apollo 13. But today,
do you remember who that is?
Cancer, along with his age, keep him grounded and bedbound. To eat, bathe, even sit up, Roper needs help.
You're watching your loved one, need more and more care. They're losing that dignity and independence.
As a veteran, the VA provides Roper with a caregiver for daily tasks. At one point, he was approved for 58 hours of care each week. Now, despite his health declining and his needs increasing, his family says those hours have been reduced from 58 down to just 13.
If you're going to thank them for their service, then help take care of them in their most needy times.
The CBS News Texas I-Team has heard from dozens of veterans facing similar cuts. The VA says it changed how caregiver hours are approved to ensure the program is being used as intended, which is to help veterans with serious medical needs with daily tasks like bathing and grooming. But internal reports we obtained show those changes have slashed hours and cut program spending in Texas by nearly $125 million in the past year, a 23% drop. And starting in 2026, another change is coming, one that could hit rural veterans even harder.
Mr. John, I'm going to turn you over a little bit, sweetheart, okay?
Michelle Jeffries is a caregiver in rural East Texas. For many of her veteran clients, she may be the only person they see for days.
How's that doll?
For her, they're family.
Mr. John, he's my buddy with him, because I got with him when he was still able to verbally communicate with us. I'm sorry.
Jeffries loves her job, but starting in January, the VA will cut rural caregiver reimbursement rates in Texas by 43%.
Don't get me wrong, I love every one of my clients, but if it comes to the point where they're going to take from me so I can't provide the quality of care that they need, I can't do this any longer because I've got to have that money to sustain my own life.
Look at all these paintings. So these paintings were done by local veterans who helped donate this to us.
Scott Wells runs Home Health Purple Heart, a caregiver agency for veterans. He says serving rural areas costs more because of long travel times and a shortage of skilled workers. But now the VA will pay the same rate in Texas for rural care as urban care. Wells says the sharp cut has forced him to lay off staff, reduce pay, and scale back services for veterans, including transportation and free legal help for VA benefits.
We're trying to do the right thing for these guys. And this kind of a cut at 43% cuts in the soul. You felt the hurt there to see that she's potentially going to have to select another job, something that she loves to do. Now, all this training time, effort, gone.
And then here's a picture of Mom with Petey.
For veterans like Harold Roper, these cuts aren't just numbers on a page. They're hours of care he no longer gets. Hours that often mean the difference between dignity and dependence.
While they're here, we need to love and respect and care for them. If they need to rectify their program on auditing, then do so. But do it to where you're not yanking it away when they need it the most.
The VA told us in a statement that its home health aid program was never meant to provide veterans with 24/7 care. The VA says there are other programs for that. We've posted a list and links to those programs on our website, cbsnewstexas.com. But Doug, let's be clear about this. Many of the veterans and their families that we talked to say that they weren't looking for care around the clock. They simply want enough hours so that they can remain in their home.
Yeah, and you can understand that. One question that comes to mind, maybe you watching as well, have other VA programs been cut too?
Yeah, not to this degree. Actually, the VA spending in Texas on programs such as emergency care, nursing homes, and dental have all actually gone up in the past year. It's these in-home programs where the VA is contracting with outside agencies that have seen this big drop.